There are different approaches for creating the small incision sclerotomy. In one case, you can take a 10-degree approach, which gives you the largest track through the sclera and the greatest self-sealing property, but you also have a greater risk of choroidal hemorrhage and difficulty penetrating into the vitreous. Alternatively, you can take the 90-degree approach, which minimizes the risk of hemorrhage and increases the likelihood that you'll get into the vitreous cavity, but it doesn't provide any self-sealing properties. Finally, you can take an intermediate approach, which many surgeons take. However, I would argue that different cases require different approaches. In most cases, I typically use a 10-degree approach to provide the greatest self-sealing property, and in those cases usually the view is very clear and we're able to double check to make sure that the sclerotomy went all the way through into the vitreous. However, in cases where the view is really quite poor, the safest approach is the 90-degree approach, which maximizes your ability to get into the vitreous.